Moving on, we'll hear from Dr. P. Ravi Kiran about oils and how it affects our metabolism. Please go ahead, Dr. Kiran.
Good afternoon to all people. I'm Dr. P. Ravi Kiran, General Physician and Diabetologist at Onus Robotics Hospital, Champapet. Today, we will discuss a topic which is very rarely discussed, the oil consumption and its effect on your health. మనం ఇప్పటిదాకా చాలా చూస్తాం. We have seen many topics where they would advise about the carbohydrate, about the fibers and everything. But there are very few discussions on oil consumption, which the patients themselves don't know. So today I would like to enlighten all the participants about the oil consumption. Let's go. In our Indian kitchens, oil is almost part of every dish. Be it biryani, be it curries, be it non-veg, whatever the curry is, we put oil in it. We unknowingly put so much oil into the curries that it's affecting our health. నేను ఎంతో మందిని చూసాను, ఎస్పెషల్లీ ఎల్డర్లీ పీపుల్, అంటే మోర్ దెన్ 50 years, మోర్ దెన్ 60 years ఉండి ఓన్లీ అడల్ట్స్ మాత్రమే ఉన్న ఫ్యామిలీస్లో దే ఆర్ కన్స్యూమింగ్ మోర్ దెన్ 3 liters ఆఫ్ ఆయిల్ పర్ మంత్, విచ్ ఈస్ వెరీ హజార్డస్. అండ్ ఇంకొక బాధాకరమైన విషయం ఏంటంటే దే డోంట్ నో వేర్ దే ఆర్ గోయింగ్ రాంగ్. They are maintaining all the health, they are maintaining all the diet, but they are not able to control their sugars and cholesterol because they are not able to track their oil. How much oil do we really need? ICMR and WHO guidelines, adult person ఒక మంత్ లో నాట్ మోర్ దెన్ 600 ml ఇన్ ఇట్స్ ఎంటైరిటీ. అంటే ఆల్మండ్ ఆయిల్ కావచ్చు, లేకపోతే కోకోనట్ ఆయిల్ కావచ్చు, ఆలివ్ ఆయిల్ కావచ్చు, గ్రౌండ్ నట్ ఆయిల్ కావచ్చు, ఏ ఆయిల్స్ అన్నా కానివ్వండి, నెయ్యి కానివ్వండి, ఆయిల్ ఇన్ ఆల్ ఫార్మ్స్ shouldn't exceed more than 600 ml per month. If there are 2 adults, 1.2 liters. If for a family of standard 4 people, 2.5 liters. But my personal advice is cut it down to 400 ml per month, because occasionally when we eat outside, the amount of oil in the outside food is extraordinarily high. Because for them to make it taste better, they have to use oil. So ideally limit it to 400 ml per month, because whenever you eat outside, that the quota of 600 ml would be completed. Types of oil and their roles. Let's discuss about the groundnut oil. This is the most commonly oil used in cooking in India since ages. So why is groundnut oil advised? Groundnut oil is high in monounsaturated fatty acids, which are good for heart. And one more thing with groundnut oil is it's heat stable. అంటే మనం ఎప్పుడైతే ఫ్రై కానివ్వండి లేకపోతే కుకింగ్ చేసినప్పుడు హై టెంపరేచర్స్లో groundnut oil is more stable, so that can be used for the same. Best for making dosa, chapati, curry base. And the safe monthly use is 600 ml per person per month. I would advise you to limit it to less than 500 ml. Apart from groundnut oil, the next oil which is making waves is rice bran oil. Rice bran also, similar to groundnut oil, it is stable at higher heats. And when cooking temperature low, higher heats low, rice bran oil is a bit stable. That's why it is also used in curries, stir fry and deep fry. Occasionally, whenever you deep fry, try to use rice bran oil. One more advantage with rice bran oil is it contains oryzanol, which helps to lower cholesterol. The same quantity of rice bran oil can be used 600 to 800 ml per month. Next common thing is mustard oil, which is not so commonly used in our Telugu states, but the advantage of mustard oil is it is rich in omega-3 fatty acids and it's anti-inflammatory. With mustard oil, the thing is generally it's not used in cooking, but it's used in seasoning. అంటే మనకి పప్పు వండుకున్న తర్వాత పప్పు మీద ఆయిల్ వేయడం కానివ్వండి, పికిల్స్లో వాడడం కానీ ఇట్లాంటివి చేస్తూ ఉంటాం. So the safe monthly use for mustard oil is a bit lower. It's somewhere around 400 to 600 ml. Sunflower oil, this is అంటే ఇది రీసెంట్ పాస్ట్ లో కొంచెం బాగా ఫేమస్ అయింది సన్ఫ్లవర్ ఆయిల్ హెల్దీ అని. బట్ వన్ డిసడ్వాంటేజ్ విత్ సన్ఫ్లవర్ ఆయిల్ ఇస్ ఇట్స్ నాట్ సో స్టేబుల్ ఎట్ హై టెంపరేచర్స్. అంటే మనం ఫ్రైలో కానీ వాటిలో అంత స్టేబుల్ ఉండదు ఆయిల్. సో దట్స్ వై ఇట్స్ నాట్ సో అడ్వైజబుల్ ఇన్ డీప్ ఫ్రైయింగ్ అండ్ ఎవ్రీథింగ్. సన్ఫ్లవర్ ఆయిల్, బట్ ఆల్సో ఎట్ ద సేమ్ టైమ్ హ్యాస్ హై omega-6 fatty acids, which is good for heart. And sunflower oil alone can't be used in a kitchen. It has to be a part of a group of oils that is utilized per month. Safe monthly use it's 400 to 600 ml per person. Coconut oil, this is one oil which we never advise to, because coconut oil has 85% saturated fat. It raises LDL cholesterol if it's consumed frequently. So it's a big no from doctors. It's best for chutney, Kerala style dishes and for flavoring. The safely monthly use for coconut oil is not more than 300 to 400 ml if it is used in its entirety. If you use 300 to 400 ml of coconut oil, you can't use any other oil for the entire month. That's how the statistics are. Olive oil, this is also one of the new oils which is making some waves in the health industry. It's known for its antioxidants and its good cholesterol. But the thing with olive oil is it is highly unstable at high temperature, so it is not advised for deep cooking. అంటే మన ఇండియాలో మనం వండుకునే ఏవైతే మన కర్రీస్ ఉన్నాయి వాటిలో we can't use olive oil because it is not that stable at high temperatures. But it can be used in salads and light saute, అంటే లైట్ ఏదైనా కొంచెం కొద్దిసేపు వేడి చేసే వాటిలో ఫ్రైస్ లైట్ ఏమైనా అంటే లైట్ కుకింగ్ చేసే వాటిలో you can use olive oils. Safe monthly use is 200 to 300 ml per person approximately. మనం ఈ ఆయిల్స్ అన్ని చూసాం కదా, వాట్ ఈస్ ద నెక్స్ట్ బెస్ట్ థింగ్ వీ కెన్ డూ? We have known that no oil is ideal for everything, so we have to use the oil rotation, the smart approach. What are those? No single oil is perfect. The best thing we are guiding you, you can utilize the resources accordingly. Groundnut oil ఉందనుకోండి, groundnut oil or rice bran oil, we can use it for daily cooking. అంటే మనం కర్రీస్ కానివ్వండి, చపాతీస్ కానివ్వండి, వాటన్నిటిలో కూడా we can use our groundnut or rice bran oil. Mustard oil కానివ్వండి, coconut oil, olive oil, ఇవన్నీ కూడా they are used only in small quantities, only for flavoring. Mustard oil for dals and curries, coconut is for only flavoring or only chutneys, olive oil for salads and raw dressing. This combination gives us a maximum advantage, but quantity being the most important thing. Not more than 600 ml per entire month. Ideal use for different cooking methods. ఇంట్లో మనం చపాతీ కానివ్వండి, దోశ కానివ్వండి చేసుకుంటున్నాం అనుకోండి, ఇట్స్ బెటర్ టు యూస్ గ్రౌండ్నట్ ఆయిల్. ఉప్మా కానివ్వండి, కర్రీస్ కానివ్వండి, రైస్ బ్రాన్ ఆర్ సన్ఫ్లవర్ ఆయిల్, బట్ రైస్ బ్రాన్ ఆయిల్ ఇస్ అ బిట్ బెటర్. మిగతా సాలడ్స్ కానివ్వండి, ఇవన్నిటి కూడా మిగతా ఆల్ ఆయిల్స్ షుడ్ బి యూస్డ్ ఓన్లీ ఇన్ లో క్వాంటిటీస్. ఆల్వేస్ రిమెంబర్ వన్ రూల్, ఎస్పెషల్లీ డయాబెటీస్ కానివ్వండి, కొలెస్ట్రాల్ ప్రాబ్లం కానీ ఉంటే కనుక దెర్ ఆర్ స్టడీస్ అడ్వైజింగ్ టు యూజ్ లెస్ దాన్ 400 ml ఆఫ్ ఆయిల్ పర్ మంత్ టు గెట్ ద మాక్సిమం బెనిఫిట్. బికాస్ మనం ఏదైతే ఫుడ్ తింటున్నామో ఆల్ ద కార్బోహైడ్రేట్స్ గెట్స్ కన్వర్టెడ్ ఇంటూ కొలెస్ట్రాల్ ఇన్సైడ్ ద బాడీ. Therefore, there is no need for additional cholesterol except for 400 to 500 ml of oils. The take-home practical rule is, per meal, a person can consume 1 teaspoon of oil approximately. So, as we won't be able to track this one, the easier thing is to track the monthly oil expenses. A family of 1 to 1.2 liter per month, if they are completely healthy with no comorbidities, if they have BP, sugar, or if they have familial comorbidities, అంటే పేరెంట్స్ కి బీపీ షుగర్ ఉందనుకోండి, పిల్లల్ని మనం ఈ జనరేషన్ నుంచి ఈ టైం నుంచి మనం we will ask them to be on the safer side to reduce the oil consumption. Simple hack is buy 1.5 liter oil for 2 adults, finish it and don't refill it until next month. I would advise you to buy only 1 liter and don't refill it till the next month, because that way you can maximize your health. Thank you.
Thank you, Dr. Ravi Kiran. Dr. Ravi Kiran, we have a question here from Priyanka. She asks, sir, are the cold pressed oils safer or market oils are safer?
That's a good question, ma'am. So regarding the cold pressed oils and the refined oils, the thing with refined oils is whenever you have to have a shelf life of more than 2 to 3 months, there has to be some ingredients which have to be added to increase the shelf life. That's the same disadvantage with cold pressed oils, because cold pressed oils don't have any ingredients in them which prolong their shelf life. So the cold pressed oils have a very short shelf life and they have to utilize immediately. That's not the case with refined oil. Whenever there is a mass production of any oils, they have to use some ingredients to protect it. And there are some topics where refined oil is not so advantageous because we lose the major nutrients present in the cold pressed oil. So if you are able to procure cold pressed oil and use it in regular basis, there are some studies which advise that cold pressed oil is better. But because it's not possible all the times, even if you use refined oils, make sure that the quantity is less. But if cold pressed oils are available, that's always better.
Thank you, Doctor. So we come to the close of today's webinar. And thank you, Dr. Vinod and Dr. Ravi, for such insightful answers and keeping everyone engaged. Before everyone leaves, we'd like to request you all to take a moment and fill the post-webinar survey that will pop up shortly after the close of today's session. It'll also be in your email after the session ends. So your feedback is very valuable to us in planning future webinars. So once again, thank you all for your time and participation. Stay healthy, stay safe, stay happy, and we look forward to seeing you all at our upcoming sessions. Thank you.